All right. Chapter 6, this is material that will be on your second lecture exam. Okay, your second lecture exam is on Chapter 6, Chapter 7, and Chapter 9. Your first lecture exam is made available today, and you will have until Wednesday, okay, March 3rd, all right, by the end of the day, 11:59 p.m., you will have to have taken it and completed it and submitted it by 11:59 p.m. So don't wait to the last minute. Okay? All right, the integumentary system, the skin, all right? This is the largest organ in your body. Okay? So when we talk about the integumentary system, we're not just talking about the skin. We're going to be talking about the skin and the accessory tissues. All right, so we'll briefly talk about nails, hair, sweat glands, and sebaceous glands. So all these structures that we'll find in the skin. Okay, so but we're mainly going to focus on the skin. So another name for the integument is the skin, but I've seen a test question that asks this as one of the answer choices. Okay, what's another name for the integument? The cutaneous membrane. There are 4 membranes in your body. Okay, the first we talked about in Chapter 1, which is the serous membrane. That's the membrane that lines body cavities. Okay, this is the second one that we're going to talk about, which is the cutaneous membrane. All right, the third one is the synovial membrane. We'll talk about that in Chapter 9. That has to do with synovial joints. Okay, it's a membrane found within the fluid-filled capsular joints. And then the last one we'll talk more about in Bio 211. It's called the mucous membrane. Okay, and so you'll find mucous membranes located around the entrances of your body and the exits of your body. Okay, it plays a certain immunological role. Okay, as does, believe it or not, the integumentary. It actually creates a physical barrier, all right, to the external or outside world. And so it's part of the innate immune system. So you learn that in Chapter 22, all right, with your immune system. There's different parts to your immune system. All right, the first part, we call it the innate immune system. All right, the innate is a preventative form of the immune system, and the integument is part of that. And so it forms a barrier, all right, to the outside world. Kind of keeps any pathogens like dangerous bacteria or viruses from penetrating into the deeper structures of your body. A lot of physicians, healthcare providers use it, all right, to do a determination of people's health. You know, if you're looking at somebody and they look kind of blue or pale, you can start to think, well, maybe they're having cardiovascular or respiratory problems, all right? Or if their skin has a yellowish appearance to it, then you're thinking, all right, jaundice, so maybe there's something going on with the liver, or they have some sort of blood disorder, okay? So one of the hardest specialties to get into if you're thinking about going into medicine is dermatology, all right? And that's the study of the skin, all right? Dermatologists have really plush hours. So let's go into a couple functions of the integument. Okay, the first one here is what we talked about on the previous slide. It's a physical barrier, so it's going to offer protection. It's going to keep harmful substances, right, and pathogens, different types of microbes, viruses, bacteria, fungi, all right, from entering into your body, all right, and becoming what we call opportunistic infections. All right, it also helps, all right, with temperature regulation, keeps you warm when it's cold outside, and it keeps you cool when it's warm outside. All right, and then the last one here, through ultraviolet radiation, we'll talk about that, okay? Ultraviolet radiation is a problem for DNA. And so you have these mechanisms in your skin that help to prevent that dangerous ultraviolet radiation from damaging your DNA. It's pretty cool. All right, it also helps with prevention of water loss and water gain. Okay, we're all familiar with the dangers of dehydration, okay? Especially if you're shipwrecked and you're at sea, all right, and you're abandoned, you can't go out there drinking salt water because you'll cause an increased amount of dehydration, all right? But it's really important that we understand that water loss, all right, will start to impact certain physiological benefits and processes. So there, a lot of folks do feel or think that their skin is waterproof. It's not. And if you ever spend too much time in the shower, bathtub, or a pool, you'll notice that your skin gets kind of wrinkly. Okay, so it's able to resist some water, all right, but it is not waterproof. So keep that in mind. Okay, so water can enter into the skin, okay, but the majority of it can be kept out. Metabolic regulation, this is when we're going to start discussing vitamin D. Okay, vitamin D is largely important for the absorption of calcium and phosphate. All right, calcium we need for many, and you will learn about it throughout this semester. We need calcium for muscle contractions, nervous system stimulation and function, blood clotting, right? And we need it as an ingredient to make strong bones. Okay, phosphate, all right. Phosphate is very important because we need phosphate for this awesome kick butt molecule, the energy currency of the cell, ATP. You heard me talk about it in chapter 2. Okay, triphosphate, adenosine triphosphate. I mean, the adenosine molecule has 3 phosphates attached to it. And those last 2 phosphates are high energy bonds. Okay, so we use calcitriol, which is the active form of vitamin D, which is made and synthesized in the skin, all right, and then it undergoes some chemical reactions in the liver and in the kidney, all right, to eventually give us, all right, calcitriol, the active form of vitamin D, and that vitamin D will help us to increase absorption of calcium, okay, in situations especially when we have low blood calcium levels. That's called hypocalcemia. Okay. All right. A couple other functions of the skin. All right. Secretion and absorption. All right. Great way for us to get rid of wastes or to undergo the cooling effect. All right. When the temperature gets too warm, all right, through sweating, as water is evaporating off our skin, it gives us a cooling effect. But at the same time, with some of our sweat glands, they will actually excrete wastes, all right, nitrogenous waste, cellular wastes, onto the surface of the skin, all right, to get rid of, all right. Also for absorption, for any of you that have ever tried to give up smoking and you had to rely on a nicotine patch, okay, it's a great way to absorb certain chemicals. All right, my dog, when he's 14 now, he lives with my dad, so I guess he's not really my dog because my father stole him from me. He was hit by a car when he was just a puppy, and he fractured his bottom 2 vertebrae. All right, the last 2 lumbar vertebrae there. He's paralyzed, couldn't move his hind legs. Well, he underwent surgery, and they used 8 rods, stuck them into his spine. Okay, and those 8 rods helped to realign his spine so it could heal. And obviously that's not going to feel good. So his doctor had given him a fentanyl patch. It was a transdermal fentanyl patch. And it was able to release fentanyl, all right, that synthetic opioid, into his bloodstream to help ease the pain levels. Okay. Immune function, you heard me talk about it briefly. All right, the fact that it is a physical barrier that keeps out certain microbes and pathogens. But we have these cells that are located, we'll talk about the dendritic cells. They're a really cool cell. All right, but these dendritic cells and amongst some other types of cells that are found in the skin, all right, these guys will help to monitor cells in that tissue. And if they start to undergo any type of abnormal growth, like cancerous cells, they're the early warning system and they kill the cell off. Okay. But they'll also, if they come across a foreign protein or part of a pathogen, like part of a virus or an actual bacteria, okay, they'll initiate the immune system response and they'll start to kill off whatever that pathogen is. Okay, with temperature regulation, kind of like what I was talking to you folks about, you know, when it's hot, the skin helps to cool you down, and vice versa. When it's cold, the skin helps to warm you up. All right, and it does so through the blood vessels, all right, that are found in the superficial layers of your skin, which is pretty much in the dermis. All right, your skin has a couple layers. We'll go through them. All right, but you have an outer layer, which is the epidermis, and then the deeper layer, which is the dermis. Well, that's where the blood vessels are found. Okay, and these blood vessels, depending on what temperature condition you're in, if it's hot or cold, all right, will change the size of the blood vessels. So the term that we give to a blood vessel that when it gets smaller, so here, say we're looking through a blood vessel, okay? This is called the lumen, the inside of our blood vessel there, okay? And that's where the blood flows. So now if we see it from the side here, okay, this is where our blood is going to flow, right down the middle here, okay? So the size of our lumen will change, all right, depending on what the temperature is. In a situation when it's cold outside, all right, say our blood vessel is this big, when it gets cold, it will shrink down to this size here. That's called vasoconstriction. And what that does is that shunts blood, because blood is 1 degree warmer than our normal body temperature. So 37 degrees Celsius, then our blood is around 38 degrees Celsius. So we shunt the blood away from the skin and we move it towards the internal organs, deeper into our core, okay? So that will help to warm us up a little bit. Now, if we're too hot, okay, then our blood vessel goes from this size to this size. So it gets bigger. That's called vasodilation. So more blood flows to the surface of your skin. That's why some people look more flush or red. And the heat is then given off and it goes out to the external environment. So it's a way to cool us down in addition to sweating. Right? And then another function here is sensory reception. Right? A vast amount of your sensory receptors are found in your skin. Okay? And so in chapter 16, at the end of this semester, we'll talk about all the different types of specific sensory receptors: touch, heat, vibration, all right, chemoreceptors. There's tons, all right, that are found throughout your skin. Okay? So these sensory receptors, as you remember from chapter 1, are going to transmit information, okay, sensory information or sensory inputs to your central nervous system, to the control center. All right, and so that's where we find quite a bit of that sensory receptors there. So let's dive into the layers of the skin. Okay, you heard me talk about the first 2 layers, right? The epidermis, which is the outer layer, and then the inner layer, which is the dermis. Now, here is a very important point. You need to star this. The subcutaneous layer, which is the layer that's below the dermis. It's not part of the integumentary system, okay? We just throw it in here because it's in close approximation to your skin, okay? So the subcutaneous layer, also known as the hypodermis, is not part of the integumentary system, okay? Just make sure. That's a great test question that can be asked, all right? I don't want you to miss that, okay? We just lump it in there because it's deep to the dermis, and we figure, hey, while we're here, let's tell you about this. Okay, so the outermost layer is primarily made up of epithelium, but it is stratified squamous epithelium, which means it's 2 or more layers of that flattened, squamous-looking epithelium. A couple things about epithelium. It's avascular, so there's no blood vessels in the epidermis. Keep that in mind. No blood vessels in the epidermis. So if you were to be messing around with some papers and you give yourself a paper cut, and no blood comes out of that cut, then you can say that you only made the cut, all right, as deep as the epidermis. It never made it to the dermal layer. That's where the blood vessels are. Paper cuts are usually just deep enough to go into the epidermis and not any further. Again, another great test question. Okay, so the inner layer, all right, the deeper layer to the epidermis is the dermis, okay? And the dermis is primarily made up of that dense irregular connective tissue, which is awesome because dense irregular connective tissue can handle multi-directional stresses. So if you pull on your skin in a whole bunch of different directions, it shouldn't tear, it shouldn't be damaged because of that dense irregular connective tissue. And then finally, all right, below the dermis is the subcutaneous layer, the hypodermis, which is not a part of the integumentary system. It's made up of 2 types of loose connective tissue: adipose, which is fat, and then areolar, which is another type of loose connective tissue, highly vascularized. All right, so here's a nice picture. We're going to go through all these different structures here, but you can see here this outer layer, that is the epidermis. Notice no blood vessels are in here. Okay, now we get to the dermis. That's this deeper layer. This is the layer that has all the stuff in it. Okay, you can see, and we'll talk about all the different stuff. And then deep to the dermis is the subcutaneous layer. Okay, that's the layer, the hypodermis, that has, you can see these yellow cells. Those are adipocytes. Those are fat cells. Okay, and you'll also have the areolar connective tissue down there. Okay, so the epidermis has 5 layers to it. Well, excuse me, 4 to 5 layers. Okay, and we'll get into that in a moment after I go through some of these. All right, when we're talking about thick skin versus thin skin. Okay, so let's talk about we're going to go through all 5 layers, and then we'll get into the specifics of where we find all 5 layers and where we find just 4 layers in your body. So the deepest layer, all right, the stratum basale. I say basale because yes, the E is silent, but I say it so you know how to spell it. Stratum basale. Don't forget the E. Also known as the stratum germinativum, okay, or the stratum basale, without the E. All right, I've seen a question asking about this. So know both terms, stratum basale or the stratum germinativum. Okay, it's the deepest layer, and you probably remember from chapter 5 when we're dealing with epithelial tissue always sits on a basement membrane. Okay, so this layer, all right, is the layer that sits on the basement membrane. All right, and now if you notice, in this layer, we describe the epithelial cells as cuboidal or low columnar. Well, cuboidal are the square-like ones, okay, or the cube-like ones. Columnar are the tall, skinny ones, and then squamous is the flattened one, okay? So wait a minute, Dr. Kaz, you said on this slide here that the epidermis is made up of stratified squamous epithelium. You're darn right. I did say that. Good thing that you were paying attention, because when we name stratified epithelium, we always name it for the apical layer. Well, what's the apical layer? The top layer. Okay? So the outermost, most superficial or top layer of the epithelium, okay, that's the name that we give it. So whatever the cells look like, even though in the stratum basale layer, all right, they are starting off as cuboidal or low columnar cells. As they move upwards, they start to change shape into a squamous shape. Okay, so the epidermis is a stratified squamous epithelium. Don't miss that. So there's 3 cell types that we see here in the epidermis. Okay, the predominant cell type are the keratinocytes. Okay, and we call them keratinocytes because they produce this. I'm going to make a t-shirt, and I'm going to have that t-shirt say keratin kills, because that's exactly what it does. Keratin is a protein that these cells make to make the cells tougher, stronger. Okay, but in doing so, when they produce this protein, it kills everything inside the cell. It kills the organelles, and eventually it kills off the nucleus. And if the cell doesn't have a nucleus, all right, it's most likely dead, except there's certain exceptions. The red blood cell is an example of that. Okay, the red blood cell does not, it's an anucleate cell, does not have a nucleus, all right, but it still lives. How do we identify the apical surface on slides where the lumen isn't clearly present? That's a great question. You're always going to have to assume, all right, unless it says otherwise, that the top of the page is the luminal or apical side, and that the bottom of the page or slide is going to be the basilar side. Okay, and you'll start to see it transition in shape. You really won't have to be asked to make that differentiation anyways in any of the tests in chapters for chapters 6, 7, and 9 for the lecture, or even for the lab for that matter. But yeah, just assume that the top of the page is where the lumen is, or is the apical surface of whatever the tissue is, and that the bottom of the page is going, or slide is going to be the basilar surface. That's a great question. All right, so keratin kills. All right, so the majority of these cells are going to end up killing themselves. All right. The other two cell types are the melanocytes and the tactile cells. I love the melanocytes because they make, all right, and store melanin. That's what gives our skin. You got it, Eric. That's what gives our skin its darker tone. And I think I like it so much because I have so very little of it. Bye, Rowan. All right. So the melanin, what it does is, all right, it is going to actually protect the DNA. How does it do that? It coats the nucleus. That's where the DNA is. So when you're exposed to ultraviolet radiation, all right, the melanocytes produce the melanin, and then they'll share it with other cells in the vicinity through what we call melanosomes. And these cells then will take the melanin and it'll smear it and put it all over the nucleus. And it coats the nucleus and it protects the DNA inside from the ultraviolet radiation. Bye, buddy. I love you. All right. The last type of cell that we see in this layer are the tactile cells. We also call these Merkel cells. Okay? And these are specialized cells because when they're compressed, they release a neurotransmitter. Okay? And you'll have a receptor cell in close approximation to these tactile cells. And these neurotransmitters then will stimulate those receptor cells, and then they'll send some sensory input to your central nervous system, right? And usually it's going to transmit information regarding light touch, discriminative touch. We get to talk more about the tactile cells in chapter 16, all right? So just be familiar with those three cell types. The second layer is the stratum spinosum, okay? Now the stratum spinosum is obviously it's adjacent to the stratum basale. And what will happen in the stratum basale is the cells there undergo division and reproduction. So what will happen is where you had one cell, you'll now have two. Well, guess what? One cell stays in the stratum basale, all right? And the other cell moves into this layer, okay? So we call these daughter cells. All right, the daughter cells are going to be the cells that result from when a cell divides. And so one of the cells will stay in the stratum basale to divide again. And the other one moves into the stratum spinosum, okay? And as it does, all right, it's going to start to form, I call it relationships, all right? Relationships with its neighboring cells, okay? And these relationships, we call those desmosomes, which are intracellular junctions. Basically, what these cells are doing to themselves is, all right, they start to sew themselves together. So they make themselves really tightly packed, which is good because we don't want stuff getting in between the cells. So they start to make themselves really tightly packed and they hang tight with one another. Okay? So this is what happens to the keratinocytes as they advance into the stratum spinosum. So the other type of cell that you're going to see here are really cool cells. We call them Langerhans cells. What they are is that they are epidermal dendritic cells. And dendritic cells are the immune cells. Okay? And these immune cells, they have a couple different types of functions. Okay? Two of which are listed below. They initiate the immune response because they're also known as what's called an antigen presenting cell, an APC. You'll learn more about that in Bio 211. But they also undergo phagocytic activity. All right, what's that? That's the Pac-Man cell. Okay, so they'll gobble stuff up. So if they see something, all right, that's foreign, they'll eat it. Or if they see an abnormal cell, a damaged cell, but mostly if it's an abnormal cell or foreign material, they eat it. All right, through the process of phagocytosis. And it could initiate an immune response depending on what it is that they ate. Our third layer of the epidermis is the stratum granulosum, thin layer, only 3 to 5. This is where, all right, your keratinocytes decide we're going to start to kill ourselves. They're going to undergo the process of keratinization. So they're going to start to produce keratin, which will start to fill the cell. Okay? And as it fills up with more keratin, all right, it will start to kill off the organelles and the nucleus. And when we don't see organelles or the nucleus inside of the cell, then we know that that cell is dead. Okay, so this starts in the stratum granulosum. Okay, all right. The next layer, this is important that you know this one, all right, is the stratum lucidum. Again, it's another thin layer, 2 to 3 cell layers thick. Okay, but here's an important fact. You will only see this material, or this layer in thick skin. In thick skin. Where's thick skin? Palms and soles. Okay? That's it. That's the only 2 places where thick skin is located. Okay? Palms of your hands and the soles of your feet. All right. We also notice, all right, that in this layer, all right, during that keratinization process, all right, we have an intermediate protein product called elidin. Okay? And in addition, this layer helps to protect from ultraviolet radiation. Ultraviolet radiation is bad. The FDA, not too long ago, I can't remember, in the past couple of years, has classified ultraviolet radiation, especially from going to tanning beds, the same. It's equivalent to ingesting arsenic. So just saying. All right, our last layer is the epidermis. Okay, the epidermis is the stratum corneum. Okay, this is the most superficial layer. So when I'm looking at you, or you're looking at me, or you're looking at somebody in your family or friends, that's what you're looking at. You're looking at their stratum corneum. Okay, all these cells, all right, are dead. Okay, they're dead. So they no longer have a nucleus. Okay, but they are tightly packed together. That's what helps to give us, all right, that water resistance to our skin. Also helps to reinforce that physical barrier, making it very difficult for certain pathogens from penetrating in towards the internal surfaces there. Okay? So this layer makes a very hostile environment for microorganisms to grow on. Not only that, because it's relatively dry, all right, but it also produces several types of chemicals that are antimicrobial. We call them defensins, all right, lysozymes. I can't remember the other 2 right off the top of my head. Oh, sebum is the other one. There's one other that's slipping my mind. All right, but all that gets poured onto the skin to help reinforce our defenses. So basically, all right, through those 5 layers, it takes about 2 weeks for the cells to get from the stratum basale to the stratum corneum. And then they'll pretty much spend another 2 weeks in the stratum corneum. So overall, it's roughly about a month, all right, for the turnover, all right, of your epidermis. Now, of course, it varies depending on where you're located, if you're in thick skin versus thin skin, all right, with abrasions and whatnot, mechanical stresses and whatnot. So you heard me talk about thick and thin skin. All right, let's talk about a couple of the variations here, all right, that we can see. First of all, thickness is a big one. The color of the skin and certain skin markings. All right, I'm going to focus on the thick versus the thin skin here. All right, thick versus thin, easy to remember. Thick skin is the palms and the soles of your feet. Okay, we're going to see that with the fingers and the toes. All right, that has all 5 layers. But this is important. You will not have hair follicles or sebaceous glands. Sebaceous glands are associated with hair follicles. Okay, so if you don't have a hair follicle, you're not going to have a sebaceous gland. But we do have sweat glands. All right? And we all know this. The palms of our hands have gotten sweaty before, and the soles of our feet have gotten sweaty. So we know there's sweat glands there. But look at your palms. Look at the soles of your feet. Do you see hair in any of those areas? You shouldn't. Okay? And if you don't have hair follicles, because you don't have hair, you won't have sebaceous glands. So thick skin has all 5 layers, whereas thin skin, all right, does not have the stratum lucidum. Okay? That is not present. Bye-bye stratum lucidum. It only has the 4 layers. Okay? Stratum basale, stratum spinosum, stratum granulosum, and the stratum corneum. That's in thin skin. Thin skin we see pretty much throughout the whole body, except for your palms and your soles. But here's the thing with thin skin. Okay? It does have sweat glands. And in addition to the sweat glands, like the thick skin, all right, this will have hair follicles and sebaceous glands. Thick skin does not. Okay? Don't forget that. Keep that in mind. All right, on to the dermis. This is the layer that is deep to the epidermis. All right, so the first layer is the epidermis, and the epidermis has 4 to 5 sublayers or strata. Okay, now with the dermis, we have 2 layers. Okay, the papillary layer, which is the more superficial, and then the deeper layer, which is called the reticular layer. Okay, that one is going to be deeper and bigger, larger, thicker. Okay. So in the dermis, we have CT proper. What's CT proper? Okay, connective tissue proper. Remember, there's 3 types of connective tissue. Connective tissue proper, supporting connective tissue, and fluid connective tissue. And then CT proper is broken down into loose and dense connective tissue. Okay, so in CT proper, we're going to see, or in the dermis, for our CT proper, we're going to see some areolar connective tissue, which is loose. And we're also going to see the dense irregular connective tissue. But not only that, we're going to see blood vessels, okay, sweat glands, sebaceous glands, because we have hair follicles there, right? When we talk about the modifications to the epidermis, we'll see nail roots, all right, sensory nerve endings, and then smooth muscle, rectar pili. Point being is, in the dermis, that's where we're going to see all the stuff. All this stuff is loaded into that area there. So if you look on this picture, I'll come right back to the slide. Okay, you look at this picture here. All right, what we're doing is we're peeling off the epidermis, leaving us with the dermis. Look at all the stuff here in the dermis. Okay, you got sweat glands, you've got sensory receptors. Here's your hair follicle. All right, and then you got your sebaceous gland hanging onto the hair follicle, blood vessels, all right, all over the place. All right, then you have connective tissue. Okay, all throughout. And here's our smooth muscle, the erector pili muscle. Okay, so the dermis has all the stuff in there, whereas the epidermis is just epithelium. All right, you have some different cell types like the dendritic cell, the melanocytes, all right, the Merkel cells there. Okay, but it's primarily made up of epithelium. All right, so let's talk about both the layers there. Okay. So the papillary layer, which is the superficial layer, all right, is going to make, it's going to be adjacent to the epidermis. It's primarily made up of a loose connective tissue, the areolar connective tissue. And as you know, areolar connective tissue, being a loose connective tissue, it will be highly vascularized. Okay? So in this layer here, we're going to see, all right, the dermal papillae there. All right, but also you're going to have your papillary plexus, which is essentially blood vessels. So they're going to be located in the dermal papillae. So the dermal papillae are these projections, these bumps that go up into the epidermis. And in these bumps, you're going to have all these blood vessels, okay, that are going to supply the epithelial tissue with nutrients and also get rid of their wastes for them. And also in these dermal papillae, you will see, that's a horrible one, right? You'll see sensory receptors in there. And we'll talk about those. So the dermal papillae are going to be these little projections up into the epidermis. But if you notice, the epidermis also has its own projections that are going down into the dermis here. Those are what we call the epidermal ridges. All right? And these epidermal ridges help to form or create your fingerprints. So if you look on your fingers and you notice those ridges there, those are the epidermal ridges. All right, so deep to the papillary layer is the reticular layer. All right, you need to know that the predominant type of connective tissue there is irregular connective tissue, the dense irregular connective tissue. I've seen that asked on questions before. Dense irregular connective tissue. Okay, and that's where you're going to have all the stuff, all the different types of glands are going to be there. The sebaceous glands, all right, the merocrine glands, the apocrine glands, all right, the erector pili muscle, which connects to the hair follicle. And so when you get goosebumps, it's because through sympathetic innervation, which is part of the nervous system, all right, it pulls on the hair follicle, all right, and it causes the hair to kind of lay down, creating these little bumps, all right, and that's usually in response to some sort of sympathetic innervation, all right, or if you're cold, if you get chills, that kind of thing. All right, so let's go down to the last part here. All right, that I wanted to talk to you about was the subcutaneous layer, or the hypodermis. Okay, again, I'm making this point. It is not part of the integument. It's not. Okay, but it is made up of two types of loose connective tissue, the areolar and the adipose. So the adipose pretty much is going to defer, all right, the functions of this layer, because adipose tissue, all right, is energy storage, obviously, all right, insulation, okay, if you have a little bit higher content of fat on you, it will help to insulate you, keep you warmer in colder climates, okay, and it also acts as protection because it can offer cushioning, all right. So the functions of the subcutaneous layer are protection, energy storage, and insulation. That's why we like to use the subcutaneous layer as an injection site, because we're dealing with, all right, loose connective tissue, and loose connective tissue is highly vascularized, and so that means we have a lot of blood vessels in that area. And if we have a lot of blood vessels in that area, then we can get a rapid rate of absorption for whatever drugs that we are injecting into our body. So it's a great place, right, to give medication. All right, let's jump into quickly here nails. Hoorah! All right, so nails are part of the integument. All right, it is an accessory to the integument. Okay, so an interesting fact, at least to me, is the nails come from the outermost layer of the epidermis, the stratum corneum. Okay, so those cells become modified, right, in this layer on the distal portions of your fingers and your toes. All right, and they offer protection. Okay, you drop something on your toe, won't hurt as bad, or on your finger if it hits you in the nail, right, depending on how big or heavy it is, whatever you're dropping. And it also helps to pick things up. Okay, so there's a couple different parts to the nails here. All right, the part that you like to cut off, right, when you're clipping your nails is known as the free edge. I'm going to go back and forth between these slides here real quick. So the free edge is this part right here. So when you're trimming your nails, right, that's the part you cut off. It looks white because there's no capillaries laying underneath it. Okay, now the part that does have capillaries underneath it is called the nail body. Okay, and that's the part on the distal end of your finger. Okay, because when you look at the nail body, it has that coloration, that pinkish, all right, coloration. That's because of all the capillaries under there. Now, the part that you can't see as it goes underneath the skin is the nail root. All right, so all three of these structures, the free edge, the nail body, and the nail root, make up the nail plate. So if we look here, all right, here's the free edge. Okay, here's the body. You can't see the root, but on the lateral picture you can. Here's the nail root underneath. So all of these structures, the free edge, the body and the nail root, that makes up the nail plate. So if you've ever damaged your finger or toe and your nail falls off, that's the whole plate. That's what falls off, this whole structure here. All right, underneath that, the nail plate, you have the nail bed, and that's made up of epidermal tissue. Most importantly, it's living tissue. It is not dead. Okay, so what we're seeing here in this picture here, all right, here's the nail bed, all of this under here. Okay, that is living epidermal tissue. Okay, a couple other parts to it. All right, we got the nail matrix, and that's the actual part that's growing. You notice how your nails grow out from your finger, okay? So they get pushed out from underneath your skin there. So that part that's pushing it out is the nail matrix. That's where we're seeing the actively growing part of the nail. If you look closely, you can see a whitish kind of structure, all right, which is this region here. This is the lanula here. And again, it appears white because it's just a thickened area underneath the nail plate. And so you can't see the capillaries underneath because it's thickened right there. All right, but we refer to that as the lanula. I think Luna, like the moon there, because it looks like almost like a crescent moon. So that's how I kind of remember the two. On either side of the nail plate, where the skin folds over, are the nail folds. That would be these areas here. Here's one, here's the other. Okay. And then, all right, where the nail plate kind of hangs over, all right, where that free nail edge hangs over, that's going to be the hypoconium. And then for those of you that have ever gotten a manicure, all right, and you've had your cuticles worked on, all right, where the nail plate has a bit of skin, all right, or tissue kind of overlapping onto it, all right, that's the epiconium right over here. All right, and that's also known as the cuticle. All right, let's get into hair, because that again is another accessory item here when we're talking about the skin. Okay, so there's three parts to the hair, and it's important that you know this, okay, or what we call three zones. All right, you have the hair bulb, the hair root, and the hair shaft. I'm going to start with the shaft because that is the most superficial portion of the hair. This is the part that you can see on yourself. So if you look down on your arm or your leg and you see hair, all right, coming out of the skin, you're looking at the shaft. So that's the part of the hair that goes above the surface of the skin, okay? Then below it, all right, that's the root. That travels from the skin surface down to the bulb. Okay, so your hair is a kind of a long, slender-like structure with a kind of a bulge at the end here. Okay, so this is the surface of the skin there. Okay, so the root is here. All right, the shaft is up here. And then the hair bulb is this guy right here. That's swelling there. All right, and it's covered by this structure called the hair papilla, which is just a connective tissue sheath that surrounds it. Okay, so this is the only area here that has living cells. All the rest of the hair is dead. Dead. Okay, so the hair bulb is the only area of the hair that has living cells. So actually, the part of the hair, all right, what we call the hair matrix, this is where we're seeing the cells that are dividing and growing. So in this region here, like we saw with the hair, with the nail root, all right, the hair matrix, okay, the cells here, when they're constantly dividing, they're going to push the hair. That's why it grows up and out of your skin, because the new cells get pushed, all right, towards the surface. All right, and this occurs here on the hair matrix. Okay, now these next couple of structures here, I'm going to show you on the slide here, two slides over. So the medulla, all right, is going to be the portion of the matrix, show you right here, all right, as the hair gets pushed upwards. Okay, so here's your matrix down here, and it starts to push the hair upwards. And so this brown line here, that's the medulla. Okay, medulla is usually always in the center. And then any tissue that surrounds a medulla is usually referred to as the cortex. And that's what we see surrounding, all right, the medulla. Okay, so if we're going to go like the outer hair surface here, when you're looking at your hair, right, you were going to see, okay, the cortex, which, well, actually you see the cuticle, which is the outer layer, okay, but just deep to the cuticle is going to be the cortex, which surrounds the medulla. The cells divide there, but they don't. Correct. Once they divide, all right, they get pushed towards the surface. So they're not like stem cells. That is correct. Keep in mind, it's the cortex that's going to give hair its relatively, its structure, okay? It gives it its firmness, so they kind of stand up a little bit. All right, the last two structures I want you to know for the hair are going to be the hair follicle and the arrector pili. Think of the hair follicle as an envelope and the hair as the letter, okay? So the outer covering of the hair, when it's in the dermis, when it's in the skin, well, I shouldn't say the dermis, but when it's in the underneath the surface there, okay? All right, that's the hair follicle, and it surrounds the hair root, okay? And so it is going to provide that connective tissue, all right, coating or the sheath there, all right, that covers the hair. And then you've got a smooth muscle that attaches onto the hair follicle. All right, so when you get goosebumps, that muscle will contract and it pulls, because one end of the muscle is attached onto the hair follicle and the other end is attached onto the dermal papillae. And it pulls that hair follicle, all right, towards the papillae there. And that papillae causes the hair to elevate, and it gives you that bump-like configuration on your skin. All right, a couple functions of hair. All right, and this, you know, you look at this list, and every semester when I look at this list, you know, I look at it and I'm thinking, you know what, most of you should know this in regards to your everyday life. Okay, for example, when we talk about the protective functions of hair, all right, when it's on the top of your head, especially if you're a fair-skinned individual, all right, it protects your top of your head from the ultraviolet radiation, from getting sunburned. Okay, if you have very long hair that maybe covers your shoulders or goes down your back, and you're a fair-haired individual, it'll protect the back of your neck and your ears. So it protects, all right, certain areas depending on where it's located, all right, from the ultraviolet radiation. Okay, again, facial expression. If you're familiar with Dwayne "The Rock" Johnson, then you know what I'm talking about, because you can smell what The Rock is cooking when he's giving you the people's eye, raising your eyebrow. Okay, so again, these hair functions, right? Part of it is facial expression. All right, raising one eyebrow if you're perplexed or if you're thinking about something. Heat retention. All right, that's again part of that goosebump phenomena to help retain heat against your arms and legs, but also on the top of your head. People that don't have hair on the top of your head, all right, compared to people that have quite a bit of hair on the top of your head, you know what I'm talking about in the wintertime. All right, all that hair helps to keep the top of your head warm. Sensory reception. When the wind blows and it blows across the hair on your arms or on your legs, all right, it will move the hair back and forth, and that will stimulate sensory receptors in the skin, all right, and you can actually feel that wind blowing. Visual identification, all right, if you see somebody with gray or white hair, you're going to assume that they're a little bit older, okay, so it helps with age perception. And then finally, chemical signal dispersal for pheromones, especially when we get into puberty, okay, and certain glands start to become active, they're going to start to emit certain scents. Some people might find it repulsive. Some people might find it attractive. I don't know. But the hair helps to disperse those smells. Okay. All right. We wouldn't be doing the integument any justice if we didn't talk about the exocrine glands. And the exocrine glands are going to be the glands that we refer to as sweat glands. Okay. So a couple types that we have are the merocrine and the apocrine. Okay, for our sweat glands. And then the sebaceous glands are something totally different. So I'm going to go through each of these here real quick here. All right, merocrine glands, okay, these guys here are going to be the ones, when we're talking about sweat, this is what you're thinking of, the merocrine glands, because the majority of what is excreted through the merocrine glands is water. So if you're out working out or you're outside and it's just really hot and you're starting to sweat, these glands here are going to produce mainly water. Right? The other 1% is going to be made up of electrolytes like sodium, chloride, right? Cell wastes and metabolites, things that have been are broken down inside of some of these cells. Essentially, sweat is a diluted version of your urine, okay? Because there's waste products in your sweat, but obviously there's also waste products in your urine, okay? But these glands play a huge role in temperature regulation, or what we call thermal regulation, okay? So as you're sweating, you're cooling your body down, and these glands help with that significantly, okay? So these are the ones that we're going to see pretty much throughout the skin, all right? And they're going to get rid of the sweat through this process of exocytosis, right? Which means the cells have these little packages in which they release the sweat contents outside the cell, okay? And that's called exocytosis. All right, the apocrine glands, okay, these are the ones that don't become active until puberty, okay? And so these types of glands are going to be found in the vicinity of hair follicles, but specifically around the armpit or the axilla, all right, the nipple area, the pubic and the anal regions. Okay, so how I remember it is the axilla, people don't start really growing hair there until they hit puberty. And these cells are located around those regions there. Okay, so they are going to get rid of their secretions through the same process, exocytosis. All right, but in this situation, the apocrine glands are going to produce a thicker kind of secretion, or what we call more viscous. And that's because, all right, these glands have a higher content of proteins and lipids. Problem is that bacteria, they like proteins and they like lipids. So when these individuals are secreting these contents on under the skin, the natural flora, all right, the bacteria, the non-pathogenic bacteria that lives there starts to feed off of it. It's like room service for these microorganisms. And unfortunately, just like with anything, when we eat, we have to go to the bathroom later on. Well, when the bacteria eat, they have to go to the bathroom also. And so it's their wastes that can start to produce a stanky odor. And that's usually when I have to tell my 13-year-old son to take a shower, because I tell him his bacteria is getting a little out of hand and he needs to do something about that. All right, the last type of gland here for the skin is the sebaceous glands. These are the self-destruction glands, the holocrine glands. These are the glands that the cells in these glands explode. And when they explode, all right, everything inside of that cell, including the secretions, are excreted out of the gland. And it produces a very oily secretion, which we call sebum. Sebum is great for several reasons. All right, it discharges its contents onto the hair follicle, and its contents help to lubricate both the skin and the hair, but also it's bactericidal. Kills off bad bacteria. That's awesome. Awesome, awesome. We like that. You can also tell when people haven't taken a shower because you can see their sebum build up on their hair because it'll give them a greasy appearance. These glands become active during puberty, okay? And it's through the hormones, especially androgens, which are the male sex hormones, all right, that stimulate, all right, the activity of those glands. All right, androgens are the male sex hormones. All right, almost done here. I do want to talk about what happens. Does sebum smell different in different areas of the body? No, it's going to be pretty much the same. Different areas of the body might smell different depending on the bacterial levels there and how they're metabolizing things. It's just usually more associated because, you know, people say the armpits. Well, that's because you have sebaceous glands there, but you also have apocrine glands there too. So it usually has to do with the distribution of the glands in certain areas of the body. And that's what will associate certain areas of the body having different smells compared to others. That's a great question, though. Yes, yes, exactly. Yes. Yes, that's good. That's true. All right, I want to finish up here and talk about aging, but also I want to talk about the repair and regeneration of the integument system. All right, you need to know when we talk about tissue damage, all right, we're going to repair it one of two ways, either through regeneration, which is the ideal way, or through fibrosis. Okay, so when you undergo regeneration, any of the dead or damaged cells, all right, are going to get replaced with the same cell type that work. So we're actually going to restore their function. So regeneration is ideal. That's what we want. Okay, but unfortunately, we don't always get that. Okay, so if we can't regenerate, then we're going to undergo fibrosis, which means that in that injury or damaged area there, all right, we are going to actually then fill that area that was damaged with scar tissue. And a lot of that scar tissue is made up of collagen protein fibers. That the fibroblasts are the cell that make that. You need to know that. Fibroblasts make collagen. Unfortunately, function is not restored. Okay? Function is not restored with fibrosis. Okay, regeneration, yay, we like it. Restored organ function because we replace the damaged or dead cells with the same type. Fibrosis, boo, bad, all right, because we had to fill the damaged area with scar tissue, collagen fibers, not with cells. Okay, so there's 4 stages to wound healing. You're going to go into this in a little bit more detail, so I'm just going to kind of go over it, kind of I don't want to say gloss over it, but I'm just going to kind of go over it well, briefly, but superficially. You'll hit more of it in 211, okay? So first part of this, the first stage is easy. We cut or damage the tissue, and we actually cut some blood vessels, which means we've actually gotten a wound that's moved down into the dermis. And that's what we're seeing here in this first picture here. Okay, so we've cut ourselves or damaged ourselves. We've cut through the epidermis, and we've gotten down into the dermis, and we've damaged these blood vessels. So blood starts to fill the wound. Okay, so as blood starts to fill the wound, we're eventually going to form a blood clot. And we're going to get leukocytes, which are white blood cells. Now, the 2 leukocytes that are first on the scene are neutrophils and macrophages. They're both going to go after any type of pathogen, bacteria, viruses, anything that gets into the wound. But the macrophages, all right, they're going to start to eat up the damaged blood vessel, the damaged tissue, okay? So the clot, its job is just to wall off the area and prevent anything else from getting from the external environment to the internal environment. So now these cells can migrate to the area, our neutrophils and our macrophages, and they can start killing any, pathogens, but they can start fixing the problem. We got a fibroblast in here, and the fibroblasts are going to start laying down collagen fiber, trying to fix the blood vessels here, okay? So that moves us on to the third stage, which is we are going to start to regrow the blood vessels that were damaged, okay? Because the blood vessels are our supply line. They're going to bring in the nutrients and get rid of the wastes. All right, but unfortunately, we're going to start to create granulation tissue, all right, which is like that pre-scar tissue that's going to start to form, okay? So in the third stage here, you can see we're starting to fix the blood vessels, and we're going to start to regrow the blood vessels. Meanwhile, while that's occurring, as you notice some blood vessels, they're starting to migrate up here towards the epithelium, and our wound gets smaller and smaller, right? And then you can see we've got tons of fibroblasts in here, and they're laying down collagen. They're just starting to repair this area. But unfortunately, they're laying down collagen tissue, and it's going to later on become scar tissue. All right, so that's going to kind of go to work there. Then our last stage, all right, the epithelium then has regenerated itself, and down below it, all right, we are going to see connective tissue fibrosis, that's scar tissue occur. So you can see here in this picture, all right, the epithelial tissue has fixed itself. Here's your little scab on top, all right, and now down here we've got our our fibrotic tissue, the scar tissue there. Okay. So you're going to go into this in a little bit more detail in 211. I just actually got done teaching it. It's really cool. We'll talk about all the vascular changes, what chemicals are involved. All right, you might not think so when you're learning it, but it's really cool to talk about, just to learn all the stuff that happens. All right, last part, aging. Okay, in a lot of our chapters from here on out, the final slides or the final topic that we will discuss, all right, will be the aging process on these systems that you're learning about. So think about when you age, you slow down. Everything slows down, okay? So what we're going to see here, all right, with the integument, all right, the activity levels of the cells that are involved in your skin are going to slow down. So we'll see a decreased number and activity of the stem cells. So if we decrease the activity of these stem cells, if you damage yourself, all right, we're going to slow that repair process down, okay? And as we're trying to replace older or damaged tissue, that decreases. So that means our thin skin becomes even thinner. That's why in older folks, they're more prone to bruising, all right, cuts, because their skin has significantly decreased, all right, especially if they experience any sort of trauma, okay? If they In some cases, if they brush by a bush with some prickers on it, all right, it can significantly damage their skin. I'm not saying they're going to bleed out or anything, but it causes issues. Well, look at this. Fewer collagen fibers, all right? Collagen is that protein fiber that adds stability to whatever type of tissue that it's in. So we're going to have fewer collagen fibers. That's definitely going to help to thin the skin, all right? The fact that we have fewer elastic fibers and that they lose elasticity, that means when you pull on the skin and you try to let go and let it rebound and go back to its normal shape, it won't do that as easily. Okay, like if you do it now, like on the skin on your back of your hand, lift it off the back of your hand, then release it. It should flatten back out. All right. If an elderly person is to do that, it does not flatten back out as well as it did before when they were in their 20s, 30s, 40s. Okay, we all know that as we get older, we get wrinkles. Okay, part of that has to do with the decrease in collagen fibers there and the decrease in elastic fibers, but also with muscles. Right, muscles aren't able to relax as easily as they used to. We have fewer dendritic cells, which means we are more prone to immune compromise. All right, if an infectious agent penetrates the skin, that sucks. That's not good. We don't like that. Okay. And of course, as we get older, we have fewer hair follicles, or the hair follicles themselves start to create a thinner hair or just stop producing and quit altogether. All right, last part here. Ultraviolet radiation, you've heard me talk about this. This is bad. The reason why? Because of what it does. It damages the DNA. Okay? And when it damages the DNA, all right, if you start to replicate that DNA and it's damaged, you can get mutations in malfunctioning DNA, which then when you start to make proteins from that DNA, they are abnormal proteins and you can get all sorts of problems. But one of the big ones is skin cancer. Ultraviolet radiation is a huge cause for skin cancer. Okay, not only that, all right, ultraviolet radiation will make you look older. As the smoking. Trust me, I lived in Florida for a while. You saw a lot of people that looked way older than they should have. And when you asked them their age, if they didn't slap you in the head because you asked them how old they were, you would be surprised by the answer you got, because you were thinking, wow, you don't say this, of course, but there's been times when I asked a couple people how old they were, and they looked 20, almost 30 years older than their actual age. And it's because they were outside in the sun all the time. Okay? So keep in mind that skin cancer is the most common type of cancer. It is 5 times more common than breast cancer, 5 times more common than prostate cancer. Okay? And we're going to see it on areas that are exposed to the sun. So where's that? On the head, on the neck. Who's more at risk? Me. Fair-skinned individual, because I produce less melanin. All right, folks that have darker skin color produce more melanin. We all have the exact, I don't want to say the exact same, but we all have pretty much the same amount of melanocytes. Gingers, that's right, I'm a ginger. All right, but here's the thing about gingers. Fair-skinned people can actually produce vitamin D quicker than darker-skinned individuals. So there is a plus side to that. There is a plus side. Well, I hate to say it, but we are at an end. All good things must come to an end. And I keep apologizing. I know I keep talking so much, and my review sessions are a little bit longer than Dr. Seiler's, I'm sure. And I do my best and try to kind of get only the really important information in there. I'll keep working on that. I appreciate y'all coming and joining me. Good. I really hope you did. It was a pleasure talking to you folks. Well, thank you. I appreciate that. You guys are the best. You make me all warm and gushy inside. Okay. I hate to do this, but I've got to cut this short and take off because I got to go and put my tie on and go to campus and teach class on campus tonight. If you do have any questions, email me, okay, or ask me in the next review session that I'll do. Dr. Seiler is going to be doing next week's at the same time, 4 o'clock on Tuesday, articulations chapter. No, I take it back. Oh, I'm doing articulations. He's going to be doing, I believe, the bone. But anyways, you all have a good night. Don't forget, you have to do a chapter summary. You have to do a summary on this. All right, it's due on Sunday. So far, from what I've been reading, you guys have been doing great for my chat sessions. Have a good night, and I will see you or talk to you in 2 weeks.